Well, the Good Doctor here on ABC57 sometimes features some pretty amazing stories of survival. In tonight's episode, a cancer patient's treatment isn't just something out of fiction. The same treatment is offered right here in Michiana. It's a special kind of chemo that's becoming more popular for treating certain types of cancers. So we went to the Goshen Center for Cancer Care to get an inside look on how it works and who it's serving here locally.
If the cancer's just in her abdomen, she could be a candidate for HIPEC treatment.
This is the treatment featured on tonight's episode of The Good Doctor. It's called HIPEC, administered with the ThermoChem HT2000. It's not in every hospital, and the only place you can find it in Indiana, right here at the Goshen Center for Cancer Care, something Dr. Leonard Henry is proud to offer.
It's the only established program in Indiana. We're getting patients from all over Indiana and the region, even outside the state.
It only treats select types of cancer.
It's called HIPEC surgery, and then we'd infuse your abdomen with a chemotherapy solution for 90 minutes.
So the common cancers this is used for include appendiceal, colorectal, ovarian, and mesothelioma, which of course is very rare.
The treatment is just starting to grow in popularity in the United States, but Dr. Henry says it's already widely used for both colorectal and ovarian cancers in Europe. One of the pioneering patients of the treatment in Goshen, Harvey Kemp. He was diagnosed with cancer more than 5 years ago.
I had it to start with. I thought it might be a death sentence, you know.
Kemp says he was at work one day and experienced debilitating pain.
I finally couldn't get off the chair.
He went to Bremen Hospital and ended up having emergency surgery.
They took out numerous tumors, and then they closed me up, but they couldn't get it all. That's what they told me.
After 6 ineffective cancer treatments, Dr. Henry recommended the HIPEC treatment.
Heated chemo. They pumped it an hour and a half inside my abdomen, and they rocked me like rocking, you know, and they called that chemo wash.
Dr. Henry says this type of chemo delivers the treatment directly into the abdomen cavity. While IV chemo is not as effective for that area of the body, this treatment is.
The doses can be much higher, and the same barrier that prevents chemotherapy from the vein getting into the abdomen is the same barrier that limits the absorption of the peritoneal chemotherapy into the blood, so it limits toxicity.
This technique, able to target the cancer in the abdomen, is why Harvey Kemp is cancer-free today.
I'm very, very fortunate for this treatment because it gave me an extended life.
And Dr. Henry says about 20 patients will be treated with HIPEC in Goshen this year, compared to just 1 to 2 per year when it first started becoming available in 2011.